Autoimmune Protocol Diet, or AIP diet, as many are calling it, is gaining a lot of attention. People are fighting inflammation, and the conversation surrounding autoimmune diseases is being elevated. So what exactly is the diet, and is it too good to be true? Joining us to explain more is Baptist Health Registered Dietitian Nutritionist Abby Tipton. Thanks so much for joining us today, Abby.
Of course.
So what is the AIP diet, and what is it used for?
So essentially the AIP diet is an elimination diet, and it targets taking out foods that have inflammatory triggers, that are common inflammatory triggers. So it starts with an elimination phase, which can last anywhere between 4 weeks to a few months, and you cut out these foods that are commonly known to cause inflammation, and then you slowly reintroduce them back into your diet in the reintroduction phase to try to pinpoint which foods are causing your specific body those triggers. Okay, and then the maintenance phase, which lasts for the rest of your life, involves having a diet that's nutrient dense, as well as avoiding those anti-inflammatory foods.
And we hear a lot about autoimmune diseases. Most of us probably know someone that's affected by that, and I know that they often want that relief somehow. So what are autoimmune diseases?
So essentially an autoimmune disease is when the body's own cells can't differentiate between their cells and an actual threat. So this can cause long-lasting damage as well as ongoing health concerns. Okay, so having one autoimmune disease can make you 10 times more likely to develop another autoimmune disease. And there are over 80 recognized autoimmune diseases out there, but some common ones are type 1 diabetes, celiac disease, psoriatic arthritis, rheumatoid arthritis, inflammatory bowel disease, which is celiac disease, as well as ulcerative colitis and lupus.
And I know that that's true with autoimmune diseases. Once you have one, it seems like you kind of have the other ones.
Yes.
I know that's how my aunt's affected, my mom's affected in that way, and it's hard to deal with. And so finding this relief through the diet is so important. So what should you avoid when you're on the diet?
Okay, so there's a pretty long list of foods to try to avoid prior to the reintroduction phase. Those foods include gluten-containing grains, nightshade vegetables, so that is your tomatoes, peppers, eggplants, potatoes, but not your sweet potatoes. Processed foods, that's going to be your refined sugar, artificial sweeteners, food additives, and food dyes. Dairy, eggs, coffee, chocolate, alcohol.
Wow.
Yes, lots of things. And then also foods that trigger your body specifically.
So that's a lot to avoid.
Yes.
What can you eat on the diet?
Okay, so some things that you can eat on the diet include so your gluten-free grains, so that's going to be, or your gluten-free starches, sweet potatoes, cassava, green plantains. And then as far as meats go, grass-fed meats, wild-caught fish, pasture-raised poultry, your organic vegetables that aren't including the nightshade vegetables, so leafy greens, cruciferous vegetables, other vegetables like that, organic fruits, non-dairy fermented foods, so that's going to be your pickles, sauerkraut, kimchi, natural sweeteners, honey, maple syrup, agave. Yeah.
I can get behind the pickles.
Yes,
for sure.
Yes,
I don't know if I could get behind the no coffee, but I could get behind the pickles.
Yeah, that one would be hard. That one would be hard, yeah.
So obviously, with any diet, it's hard to follow. It's hard to get in that mindset.
Yes.
So for people that are dealing with autoimmune illnesses and they feel like they need to be on this diet, what are some tips for them to kind of ease their way into it and make it a successful practice?
Yes. Well, one of the main things is fully committing to the whole diet, because you're not going to reap the benefits from doing the diet or beginning the diet if you don't commit to it fully. So really trying to stay on track with that, trying to follow all the guidelines, that's going to help a lot, as well as planning ahead. So whether that's for work, vacations, holidays, anything like that, trying to keep something on hand just so that way you stay on track. Also finding different snacks and meals that you enjoy, that's going to help you a lot just to stay on track, and that way you're not eating the same things over and over again and it starts to get a little bit monotonous. So yeah, I would say that. And you could also find some resources, whether that's a functional medicine doctor, a registered dietitian, a rheumatologist, or a reputable source online.
Absolutely. Yeah. And this is something that you'll see a lot of health blogs posting about, how to achieve this diet or what healthy foods you can eat on this diet. And of course, they're claiming that it is very effective. Is it as effective as a lot of people are saying, as this trend is kind of bringing to light?
Yeah, there are some studies that are showing that it can help a lot with reducing inflammation. It's similar to the paleo diet, which is known to reduce inflammation, so it kind of has those same aspects, but it's more individualized to the person.
Okay.
So you can kind of pinpoint which foods trigger your body and your autoimmune symptoms and avoid those.
And I guess you get some of that personalization with that reintroduction phase you mentioned.
Okay. Yes, absolutely, absolutely.
Is there anything else you'd like to add today about AIP diet?
Like I said earlier, really commit to it if you're going to do it. You know, there's no point in not doing all the 3 phases, and reach out to a healthcare professional if you want more information, or find a reputable source online.
All right, well, Abby, great information. Thanks so much for joining us today.
Thank you for having me.